Have you ever experienced a situation where your period didn't arrive on time? Maybe it was late by a few days, maybe even a week, and suddenly your mind started asking questions. Is something wrong with my body? Could it be stress? Is it pregnancy? Or is it something more serious? A late period is one of the most common concerns people have about reproductive health. And yet most people don't fully understand why it happens. In today's video, we're going to explore everything you need to know about delayed periods. We'll talk about how the menstrual cycle actually works, the most common reasons periods come late, medical conditions that affect menstrual cycles, lifestyle habits that can delay your period, when you should see a doctor, and how to maintain a healthy menstrual cycle. By the end of this video, you'll have a clear understanding of what's happening in your body and when you should be concerned. So make sure you watch until the end because some of the causes might surprise you. Let's begin. 1. Understanding the menstrual cycle. Before we talk about why periods come late, we first need to understand how the menstrual cycle works. The menstrual cycle is a natural process that prepares the body for pregnancy every month. The cycle begins on the first day of menstrual bleeding and ends the day before the next period starts. For most people, the average cycle lasts about 28 days. However, cycles between 21 and 35 days are completely normal. Every menstrual cycle is controlled by hormones. These hormones send signals between the brain ovaries and uterus. When everything works normally, the cycle follows a predictable pattern. The menstrual cycle has 4 main phases. The first phase is called the menstrual phase. This is when the body sheds the lining of the uterus, causing menstrual bleeding. This phase usually lasts between 3 and 7 days. The second phase is the follicular phase. During this phase, the brain releases hormones that stimulate the ovaries to produce follicles. Each follicle contains an immature egg. The third phase is ovulation. Ovulation happens when a mature egg is released from the ovary. This usually occurs around the middle of the menstrual cycle. Ovulation is the time when pregnancy can occur. The final phase is the luteal phase. During this phase, the body prepares the uterus for pregnancy. If pregnancy does not happen, hormone levels drop. This causes the uterine lining to shed, and a new menstrual cycle begins. Now here's something important. If ovulation happens later than expected, the entire cycle shifts forward, and that is one of the most common reasons a period comes late. 2. What is considered a late period? Many people panic if their period is just a few days late. But in reality, small delays are extremely common. A period can vary from month to month. Doctors generally consider a period late if it doesn't arrive within the expected cycle range. For example, if your cycle usually lasts 28 days, but your period arrives on day 31 or 32, that's usually normal. A delay of 2 to 5 days is very common. Even a delay of up to 1 week can happen occasionally without any serious reason. However, if your period is more than 10 to 15 days late regularly, it may be worth investigating. Also, if you miss multiple periods in a row that could indicate an underlying issue, understanding your normal cycle is very important. Tracking your cycle using an app or calendar can help you identify unusual changes. 3. Pregnancy, the most common cause. One of the first reasons people think about when a period is late is pregnancy. And for good reason. Pregnancy is the most common cause of a missed period. When pregnancy occurs, the body produces a hormone called human chorionic gonadotropin, or HCG. This hormone prevents the uterus from shedding its lining. As a result, menstrual bleeding stops. A missed period is often the first noticeable sign of pregnancy. However, other early pregnancy symptoms may include fatigue, nausea, breast tenderness, mood changes, frequent urination. If your period is more than a week late and pregnancy is possible, taking a pregnancy test is recommended. Most home pregnancy tests are very accurate when taken after a missed period. 4. Stress and emotional health. Stress is another extremely common reason for delayed periods. When your body experiences stress, it releases hormones like cortisol. These stress hormones affect the hypothalamus, a part of the brain that regulates the menstrual cycle. The hypothalamus controls hormones responsible for ovulation. When stress disrupts these signals, ovulation may be delayed. And when ovulation happens later, the period also arrives later. Stress can come from many sources: work pressure, exams, relationship problems, financial difficulties, emotional trauma, even lack of sleep. Sometimes people underestimate how much emotional stress affects physical health. Managing stress through relaxation techniques, Exercise or meditation can help regulate menstrual cycles. 5. Weight changes. Body weight plays a major role in hormonal balance. Sudden weight loss or weight gain can disrupt menstrual cycles. The body requires a healthy amount of body fat to produce reproductive hormones. If someone loses weight very quickly, estrogen levels may drop. Low estrogen can stop ovulation temporarily. This can lead to missed or delayed periods. On the other hand, excess body fat can also disrupt hormone balance. Obesity can cause increased estrogen production, which interferes with ovulation. Crash dieting, eating disorders, and extreme calorie restriction can also cause irregular periods. Maintaining a balanced and healthy weight is important for reproductive health. 6. Excessive exercise. Exercise is beneficial for overall health. However, too much intense physical activity can disrupt the menstrual cycle. Professional athletes often experience irregular or absent periods. This condition is sometimes called athletic amenorrhea. When the body experiences intense physical stress, it may conserve energy by reducing reproductive functions. Long training sessions combined with low-calorie intake can cause hormonal imbalance. As a result, ovulation may stop temporarily. Moderate exercise supports hormonal balance, but extreme overtraining can have the opposite effect. 7. Hormonal imbalances. Hormones control every stage of the menstrual cycle. When hormone levels become imbalanced, the cycle can become irregular. Hormonal imbalance can occur due to many factors: lifestyle changes, chronic stress, certain medications, medical conditions. One common hormonal disorder affecting menstrual cycles is polycystic ovary syndrome, also known as PCOS. Polycystic ovary syndrome, PCOS. PCOS is one of the most common causes of irregular periods. This condition affects millions of people worldwide. In PCOS, the ovaries produce higher levels of male hormones called androgens. These hormones interfere with ovulation. As a result, eggs may not be released regularly. When ovulation doesn't occur, periods become irregular or delayed. Common symptoms of PCOS include irregular periods, acne, weight gain, excess facial or body hair, difficulty getting pregnant. PCOS can be managed with lifestyle changes, medication, and medical guidance. Early diagnosis can help prevent long-term complications. 9. Thyroid disorders. The thyroid gland is located in the neck and plays a major role in metabolism. It also influences hormone regulation throughout the body. Both overactive and underactive thyroid conditions can affect menstrual cycles. An underactive thyroid called hypothyroidism may cause heavy or irregular periods. An overactive thyroid called hyperthyroidism may cause lighter or missed periods. Other symptoms of thyroid problems include fatigue, hair loss, weight changes, mood changes. If thyroid disorders are treated properly, menstrual cycles often return to normal. 10. Birth control and medications. Hormonal birth control methods can also affect the timing of periods. These include birth control pills, hormonal IUDs, contraceptive injections, hormonal implants. These methods change hormone levels in the body. Some people may experience lighter periods. Others may experience delayed or missed periods. Certain medications can also affect menstrual cycles. For example, antidepressants, steroids, antipsychotic medications. Always consult a doctor if medications seem to affect menstrual health. 11. Puberty and early menstrual years. Irregular periods are very common in teenagers. When menstruation first begins, the body needs time to establish regular hormone patterns. During the first few years, ovulation may not happen consistently. As a result, cycles may vary from month to month. It can take 1 to 2 years for menstrual cycles to become regular. This is usually completely normal. 12. Perimenopause. Later in life, menstrual cycles may become irregular again. This stage is called perimenopause. Perimenopause is the transition period before menopause. Hormone levels fluctuate significantly during this time. As a result, periods may become unpredictable. They may come earlier, later, heavier, or lighter. Eventually, menstruation stops completely. This stage is called menopause. 13. Illness and lifestyle changes. Temporary illnesses can also delay periods. When the body is dealing with infection or inflammation, hormone production may be affected. Travel can also disrupt menstrual cycles, especially when crossing time zones. Changes in sleep patterns, diet, or routine can affect the body's internal clock. Even small lifestyle changes sometimes influence the menstrual cycle. 14. When should you see a doctor? Occasional delayed periods are usually not a cause for concern. However, medical advice may be necessary if your period stops for more than 3 months. Your cycles become extremely irregular. You experience severe pain, you have unusual bleeding, or you suspect pregnancy. Doctors may perform tests such as blood hormone tests, ultrasound scans, thyroid tests, pregnancy tests. These tests help identify underlying causes. 15. How to maintain a healthy menstrual cycle. Maintaining a healthy lifestyle can support regular menstrual cycles. Some helpful habits include managing stress, eating balanced meals, getting enough sleep, exercising moderately, maintaining a healthy weight, tracking menstrual cycles regularly. These habits help maintain hormonal balance. A late period can happen for many different reasons: stress, hormonal changes, lifestyle habits, medical conditions, or pregnancy. Most delayed periods are temporary and resolve on their own. However, understanding your body and tracking your cycle is important. If irregular periods happen frequently, seeking medical advice can help identify the cause early. Remember, menstrual health is an important part of overall health. Taking care of your body and staying informed helps you maintain long-term well-being. If you found this video helpful, make sure to like the video and subscribe to the channel. Also share this video with someone who might find it useful. And if you have any questions about menstrual health, feel free to leave them in the comments. Thanks for watching, and we'll see you in the next video.